The human heart is amazing. About the size of a clenched fist, its job is to pump oxygen-rich blood to the entire body every second of every day. The heart's ability to work well depends on many factors. One factor is the heart's electrical system. You're watching this video because you have an electrical problem and may be a candidate for this procedure. This video will educate you on how electrical problems of the heart can be diagnosed and treated. We cannot show you all rhythm problems, but the way the study is done and the treatments available are the same. When the electrical system is working properly, the heart beats in a regular pattern or rhythm. If the heart conducts the electrical signals in an abnormal way, it results in abnormal patterns or rhythms. In the medical world, these patterns are called arrhythmias. Arrhythmias can produce symptoms that range from annoying to life-threatening. Sometimes an electrical shock is even required to get the heart rhythm back to normal. Until recently, the usual treatment for such conditions has been medications, often lifelong and often with side effects.
I ended up with drug treatments to try and stop the arrhythmia, the racing of my heart. Then they've also had to cardiovert me as well, which means that they had to shock me.
Advances in technology now allow heart specialists to find the exact area of the electrical pathway problem. This is called an electrophysiology study. Once the area is located, it can be treated by applying either heat or cold. This is called an ablation. Many times, it completely corrects the problem.
You may have had a heart tracing done before in an ECG. Think of this as having an ECG but from inside the heart, which is a lot more precise and accurate. The second part is to see if there's the presence of any accessory pathways, which basically means if you have extra wires that can be the setup to have a short circuit. Now these short circuits, as you probably know, are the ones that are causing your symptoms of chest pain, fatigue, tiredness, feeling unwell. And hence, if I can localize where the pathway is located, I can then use my catheters with either radiofrequency or heat, or cryoablation or cold to treat these effectively. So I've just completed a cardiac ablation procedure, and this individual happened to be on 10 various medications. Now, from having the procedure done, I can essentially discontinue 2 medications right away. These 2 meds are known to have the side effects of fatigue and low energy, and this is some of the symptoms that this individual was experiencing. So you can see the results right away. The procedure's done, 2 medications right off the bat, you can discontinue.
As you just heard, medications may be stopped or adjusted during the months ahead. Some people may feel improvement immediately. Every case is individual and must be evaluated by the electrophysiology doctor.
I'm not on any heart medication. My cardiologist has given me a clean bill of health, no heart damage. Life has gotten better.
There are some important things you need to know about the procedure day and how we will care for you.
As with any medical procedure, there's benefits and risks. I'd like to take this opportunity to discuss some of the risks that may be potentially involved with the procedure that you'll be having done. They're small and vary in the range of 1 out of 1,000 up to 1 out of 3,000. With the common procedures that are performed, there's a 1% risk of getting a bruise or bleeding at the leg where the needle is injected to access the vein. There's a 1% risk of bleeding around the heart, and very rarely, 1 out of 1,000 times, surgical intervention is required. There's a 1% risk of stroke with certain procedures or clot formation, and very rarely with some specific procedures, there is a 1 out of 3,000 risk of having a lethal complication.
After the doctor has discussed this with you, you will be asked to sign a consent for the procedure. A specialized medical team will be with you at all times during the procedure. The hospital will contact you regarding the day and time of the procedure. You will be given instructions about what to do with your medications. Eating and drinking restrictions will also be discussed. Someone will need to pick you up from the hospital when you are discharged. You will also require someone to stay with you the first night you are at home. Please make these plans before coming to the hospital. Some people are discharged the same day as the procedure. Others may have to stay overnight in hospital. After the procedure, you will require a time of observation in hospital. This varies from person to person. You will need to register in admitting with your health card. You will then be directed to the electrophysiology lab. When you get to the lab, a nurse will start an IV. Monitoring equipment will be applied to your chest and leg. You'll receive medication before and during the procedure to help you keep calm and comfortable. Freezing will be used before any procedure lines are inserted. Medical staff will monitor you and provide mild sedation as needed. You'll be on your back throughout the procedure, which may take up to 4 hours.
Atrial fibrillation is one of the most common rhythm disturbances that are seen in family doctors' offices or the emergency room. There are 3 principles of management with this condition. The first is that individuals with atrial fibrillation are at risk of developing a clot or having a stroke. The second issue is that your heart may weaken, especially if the heart rates are exceedingly fast and not well controlled. And thirdly, symptoms, and that's kind of the main reasons people would seek medical attention. So mainly for people who are exhibiting symptoms, it would make sense that if the rhythm is causing the symptoms, then eradicating or eliminating the rhythm will alleviate their symptoms. There's 2 modalities. There's either the use of heat or radio frequency, and the other modality, which is new in the country, so to speak, but being used in Europe and the United States, is cryoablation, and it involves the use of a balloon to freeze the area where the abnormal cells are located. Our hopes are that you'll be cured of your cardiac arrhythmia with a single procedure. Keep in mind that everybody has a different anatomy and different heart, so there may be times where you may require a follow-up procedure.
Before you are discharged, a nurse will go over important instructions including activity, medications, and what to report to the doctor. Many times, people require follow-up with their family doctor or cardiologist. This will also be explained. To keep your heart strong and healthy, you still need to manage diabetes, cholesterol, and high blood pressure. Try to get regular exercise, follow a heart-smart diet, and quit smoking. Cardiac rehabilitation programs can help you gain skills and confidence in managing heart disease. Why not join a program in your area? Do it for yourself and for those you love.